so we can share with anyone who did not get to join us today. All right, so good morning, everyone. My name is Ashley Tostarelli, and I am the Home Visiting Manager at the Office of Early Childhood. Thank you for joining us today for our April provider meeting. I'm joined by my colleagues at the Office of Early Childhood on this meeting, which many of you already know. We have Rachel, Jennifer, Dia, Stephanie, Lindsay, Connie, Sadia, and Ria. Ashley McAuliffe and LaKaisha are not able to join us this meeting, but they're here with us in spirit. So we'll go to the next slide, Haley. So today on our agenda, we're going to talk about our site visits that are going to be taking place, contract evaluation reminders, the ARPA mini grants that are still available, as well as some contract changes that come July 1, 2024. And then from now till the end, think of any announcements or highlights that you want to share with your peers across the state. So next slide, go ahead. And I'm going to turn it over to Rachel.
Hey, good morning, everybody. How are you? So talking about our site visits, we are looking for them to take place in the month of June. The focus of these visits will, can't hear me? Can you hear me now? Yeah, okay. So sorry, I'll start over for those of you that couldn't hear me. Just briefly going over the site visits, we are looking for them to take place in the month of June. The focus will be on the results of your 33-month contract evaluation. We are not requiring you to have any kind of presentation or report. It is strictly just going to be, conversational and going over those results. So we are not expecting you to put in any additional work. We know it's a busy time, so we are not looking for any of that. The visits will be virtual unless decided differently among your program and liaisons. If it's something that, you guys like seeing each other face to face, that's something you guys can discuss with each other, and that is also an option. So next slide. Looking at the 33-month contract evaluation, we had put out the request for information form as well as the rubric. You should have received that. If for some reason you have not, please let your liaison know and we can resend it out to you. So just a few reminders, the evaluation that we are reviewing is for the period of October 1, 2023 through March 31st, 2024. As I stated before, the results will be shared during your site visits in June. As a enhancement, we are looking to maybe change a few things with our contracts evaluations going forward. So we are in the process of starting a pilot where we invited 6 contractors to take part in this pilot of an enhanced contract evaluation tool, which will be completed right alongside this regular 33-month evaluation. Some of the modifications include changes to, the weight and scoring, additional benchmark measures, and a refined sparkler measure. Additionally, these participating programs will test out our new staff employment module in ECIS, which will capture things like our staff demographics, salary information, education, training, and certificates that they have. More will come on that as we move forward, but our crew that, is doing this pilot with us is going to be testing it out so we can work out any bumps along the way and present it all to you guys. We're very excited about that. Next slide. And then Ashley, I'm going to turn it back over to you.
Yeah, thanks, Rachel. So just a reminder that we have the ARPA funds still available, which are those mini grants that you applied for through the Connecticut Children's Alliance. We're applying through the new application was sent out in the OEC update email and the newsletter that was sent on March 5th. So you can refer back to that. So they've updated it a little bit to get information more on the front end instead of following up with additional questions later. So next slide, Haley, just to go into a reminder of what the mini grants are, we had to select when we applied for this funding, we had to select within the cost standards that our funder allowed us to. And so these are the categories that we could apply for. We have funds available for staff incentive pay. So this includes funds for agencies to offer incentive payments or stipends to employees within their home visiting program. We have funds available for staff technology needs. This is any tech needs that your staff may need, including computers to meet telehealth needs, iPads, subscriptions for virtual platforms or Wi-Fi hotspots, as well as personal protective equipment line item or cleaning supplies. So these funds are available to request for PPE specifically, or even cleaning supplies to keep families and your staff safe. This can include hand sanitizer, gloves, disinfectant spray, masks, paper towels, wipes, whatever you need to have a clean work environment or home for families. So you can purchase these supplies for families too. Next slide. There is a home visitor training option to apply for. Within this training, we have some funds available that we're going to be offering an IPV-DV training for the home visiting network before September, as well as we're offering a protective factors TOT training. So we're hosting a strengthening families protective factor framework, TOT. We have limited spots, but we would like to have trainers in each of our 6 regions. So if we're looking for volunteers still. This went out in a letter or a notice from Sadia in one of the emails a few weeks ago. If you have any interest, please reach out to your program liaison by this Friday so we can get you registered for that training, which will take place in May. The exact dates off the top of my head, I think it's May 14th, 15th, and 16th. Also within this line item, there's funds for home visitor and staff professional development. So we have availability for agencies to request funding for trainings, professional development, conference attendance. So please, we have funds. They have to be spent by 9:30. Please submit applications. They'll be reviewed and you'll get a response within 1 to 2 weeks. And if there's more information that's needed, we'll reach out to you for that as well. Next slide. And the last category that you can apply for funds for is for technology needs for enrolled families. So when we submitted this application, we conducted a survey of the field, and at the time there was still a high need for tech needs for families. And so funds can be requested to purchase iPads, tablets, Wi-Fi connections, or anything else to support engagement in virtual visiting and telehealth when you can't do in-person visits. Okay. So we will move on to now the next part of our meeting, which is oh, sorry. Yep, Toral.
Um, Actually, I just had one clarification question. So
Mhm.
when these funds are requested by subcontractors, how is the payment working? Is it directly going to them and then they are responsible for reporting, or still goes to the main contractor and then we are supposed to give it away? How is that process working?
Yeah, so the way it works is when they apply, and they're awarded, they follow up with additional questions for how they want to receive payment, whether it's a check or direct deposit. So it goes directly to the person applying, the subcontractor. We didn't want leads to have to be responsible for this kind of thing. And they're responsible for the reporting as well as to how they used the funds, how many people were served, because then we need that information to report to our funders, how many families were reached, how many staff benefited, those kind of things.
Sounds good. And then you will directly work with the subs to make sure the reporting goes back to you, right?
Yes, and our subcontractor that's managing this grant for us, they'll actually be going back and forth with the subs, and then they give us the reports.
Perfect. Sounds good. And then just the same line, can the leads request some amount for the whole network, or can they only have to do it for their own organization?
No, they can request for the network. We've had Regents come together and request a training. We've had models come together and request a training. So it doesn't have to be just to benefit your program specifically. If you are requesting to bring in a speaker, it might benefit to offer it to the entire region.
Okay, thank you.
Mhm. Okay, so I see people are answering questions in the chat. The supervisor should complete the application just because they'll know the payment information and those kind of things versus home visitors. But we encourage you to get ideas from your home visitors for things that they need, trainings they're interested in, those kind of things. Okay. So now we're going to move into upcoming changes for the July 1 contracts. So for this section of the meeting, we'll be reviewing contract changes that will take place for the upcoming 2-year contract. This 2-year contract will bring us to the close of our 5-year RFP cycle, which will be June 30, 2026. And then later next year, we'll be releasing a new RFP for new contracts that would start July 1, 2026. So as I go through these upcoming changes, we'll be answering clarifying questions today. But if you have specific questions regarding these changes, you may schedule a 30-minute meeting through your liaisons where our division director will attend to answer specific questions that you have regarding these. Just note that Ashley McAuliffe is not available the week of April 15th and through the 19th. So meetings will have to be before or after that. Okay, next slide. So since the release of, I'm sorry.
Again? I'm sorry, could you restate the timeframes again?
So this contract that will be starting July 1 is going to be a 2-year. It'll go from July 1, 24 to June 30, 26. And it's going to be wrapping up the 5-year RFP cycle before we're required to RFP again. Okay, so since the release of the RFP in September of 2020, the home visiting system has had significant increases in the overall funding level. Since July 1st, 2021, the start of our RFP contracts, the system as a whole has received an additional $3.7 million. These increases were seen in 22, 23, and 24. The large jump was from the COLA additions from both 22 and 23 being paid out in fiscal year 23. Although we see an increase, we did have the loss of ARPA funding, the American Rescue Plan Act funds, that were time limited and expiring, resulting in the need for our funding reductions last year. The ARPA funding was not included in these numbers as it was a separate pot of funding and not part of our appropriated state or MCV dollars. So these increases have allowed us to right-size our system, increasing wages of staff to meet minimum salary guidelines. Our system has more funding than it's ever had in the past, and that's something we're really proud of. Next slide. With this significant increase in funds, Commissioner Bai and Deputy Commissioner Trueworthy have requested, reviewed, and assessed our home visiting data, including visit frequency, enrollment numbers, performance outcomes, referrals, and screenings. The Home Visiting Division has been tasked by Commissioner Bai and DC Trueworthy to review our numbers and dive deeper into the data to ensure programs are reaching, enrolling, and visiting more families. This is also a key point of Commissioner Bai's message at our home visiting conference in December. As you know, last month at our regional ACM, we focused on frequency of visits at the regional and provider levels. In this big picture view, you can see that in FY 2020, before the RFP, annual visits across the system were around 40,000. As we moved into the pandemic where family needs were high and our system shifted to virtual services, we saw a large increase in the number of total visits completed, about a 5,000 number increase. With FY22, there was a slight decline in home visiting that we expected due to programs closing and new ones starting from the ground up with the RFP. Last year in FY23, the system leveled out to pre-RFP levels, and many models were able to continue both virtual and in-person visits. For the remaining 2 year of our contract cycle, we will be, at the Commissioner's request, focusing on visit frequency, the family experience as documented in ECIS, such as retention and their engagement efforts, and capturing employment data for our workforce with the goal of sustaining current levels of funding and potentially advocating for even more funding to expand services. Next slide, Haley. So to start our contract changes, we're making a change to our invoice process. Currently, there's no language in the contract regarding discrepancies for quarterly invoices or payments. With the July 1, 2024 contract, contractors will have 15 days to review and address any discrepancies on the OEC generated invoice. Programs will work with their liaisons to make the necessary changes so that your program can submit the invoices to the accounts payable email to begin the payment process. Once a payment is received, if there are any additional discrepancies or questions, concerns regarding the payment, those must be submitted within 30 days of receipt of funds. Once the 30 days has passed, the OEC will no longer make retro corrections to payments. The reasoning for this is that there were a significant number of requests asking OECD staff to rectify and clarify payments that were made up to 2 years ago, resulting in a significant amount of time for staff, both on our end and fiscal's end, digging in to see why rate card was X amount of dollars and how much each subcontractor received and why did I not receive this rate card payment. So moving forward, we have a time limit for programs to ask these questions, but also on our end, we are going to be here to support and create systems with payments so that there's little to no questions that will need to be asked around payments. Okay, next slide. The next change for the contracts will be around rate card payments. Currently, outcome payments are made every 6 months based on an ECIS report of what each program earned. The current payment structure has caused challenges at the end of the fiscal year when closing out reports in core and ensuring there is enough time to spend down the second half of the money you earned. Moving forward, outcome payments will be split into 2 equal payments based on your maximum earning potential. These payments will come in quarters 1 and quarter 2. So if you have $10,000 pot of rate card funds, you'll get $5,000 of it in quarter 1, $5,000 of it in quarter 2 to be paid out whole in the first 2 quarters. What does this mean for you? This means that your budget and contractual liaisons will be working closely with your program to monitor what you've earned each quarter versus what you're spending. These conversations will be discussed at ACM meetings to ensure that programs are not overspending rate card funds that they haven't earned yet. Allowable funds language will also slightly change. We have added language that we will disallow any expense funded by outcome payments that fall outside of the examples listed in the contract or that you did not receive written prior approval from. Currently, the contract just says that funds that do not comply with the federal cost standards and allowable costs will be denied. Next slide. And so this is rate card payments continued. With the change of prepaying rate card dollars, the outcome funds language has been changed to reflect the return of rate card funds that were paid but not earned, in addition to those that were not expended. So although funds will be given at the start of the budget year, practice should be that you're only spending funds as you earn them. If you spend more than you earn, contractors will have to come up with the amount of funds that they did not earn to return to the OEC at the end of the fiscal year. Next slide. So the next change is around caseload and visit frequency. Contracts will still contain the number of home visitor FTEs that are employed. We have that listed in our current contract, and that will stay. We are adding a minimum visit frequency to ensure the number of completed home visits continues to improve with our increase in funding so that with the new contracts, each home visitor shall complete a minimum of 10 visits per week. This number will be modified based on the home visitor's FTE. So for example, if you have a half-time home visitor, they will be expected to complete 5 visits per week. OEC is developing a data dashboard that will help liaisons support providers in ACM calls to review real-time data from ECIS that can look at visit completion rates by home visitor, including diving down to the family experience or expected frequency as documented in ECIS. For example, if a family enrolls in a program expecting or agreeing to weekly visits, is that family being seen weekly? Or if they request monthly or your model dictates that they should be seen monthly, is that program meeting their needs or expectations?
Ashley?
Yep.
Do you want us to hold questions to the end, or can we ask questions as you go along?
Let's hold them till the end because I think I only have 2 more slides. Oh,
Okay.
maybe I have. We'll wait till the end. Okay, the next change is programmatic statistical reporting. So the first change that we're adding the language around the collection of employee level data in ECIS. Currently, we don't have any, we only have client level data in ECIS, but not employee level. The reason that we're adding information and this module to ECIS is that we are the only division at the OEC that does not currently collect employee level data. OEC collects this employment data on all our state-funded early care and education programs. Any staff licensed childcare centers, group home or family home staff, we have this information on, as well as any professional in the education atmosphere that's going through the career ladder of the Connecticut Registry. How will we use this data? We'll use this data to better understand our workforce and who is providing services to families. How are the staff reflective of the communities they provide services to, both demographically, but also with their training and certificates and employment history or experience if staff decide to provide that information. The information in ECIS will make it easier to monitor salaries for minimum compensation guidelines and contract evaluations versus how we're currently doing it in CORE, which is not always updated to accurately reflect new hires and salary changes. This information will also allow us to easily monitor vacancies of staff, which we have to report to our funders. This will help us monitor caseload levels by FTE, which we all knew was a limitation in our ACM regional meetings. It will provide real-time count of how many FTEs by role are in our system, as well as be able to report on the achievements of the field, our educational levels, our certifications and trainings. For example, how many of our home visitors are doulas, how many of our staff are infant mental health trained. So that will be a new thing in July 1. Next slide. Oh, sorry, go back to that slide. The date changes around here is that some contracts had benchmark reporting starting in July 1 on the left. And in the next change is going to be July 1 for the first quarter because we can't go reference other contract periods. But then after that, it'll go back to the benchmark year of October 1 to December, October 1 to March, and so forth. Next slide. The next is around quality assurance, and this is just our contract evaluation. So we changed the language. Currently, it just says that we'll evaluate the contract in these things, and we had to put the timeframes in our contracts. But as you know, we modified our timing for this year. Instead of doing a 6-month evaluation, we were doing a 9-month now. So instead of having to amend contracts, we're going to put the dates in our home visiting manual to eliminate the need to amend all these contracts. Additionally, we're adding a Sparkler initiative. Sparkler has been an initiative that's been strongly encouraged by the OEC. However, based on the utilization success across not only our home visiting, but the rest of OEC, Sparkler is moving from an initiative to an expectation where we require families to be informed of and offered Sparkler, not just new families or the ones you think might benefit. So all families should be offered Sparkler. Next slide. And the last change of our contract is around high performance programs, and it's just language changes. So the last change, we enhanced the portion of the contract that went into how we determine high performing programs. Currently, our contracts say that we'll conduct reviews at the end of Q1 and Q2, but we have added that we will perform contract evaluations at a time specified within the manual to assess contract compliance and outcome performance, and that these evaluations will be our way of defining high performing programs and or determining contract extensions. So it's just modifying the language a little bit. So next steps, and I'll take questions after this. We'll be sending these slides out with our recording link. If you have any questions regarding anything we reviewed today, please feel free to schedule an April meeting through your program liaison to meet with our division director and them, just not the week of April 15th. And we look forward to our pilot evaluation that our programs that we've invited to participate in. We look forward to their feedback and how they view and feel about the new employment module, and we'll share the results with the field after that. So I don't know if there's, Leora, was that you?
Yeah, I had some, that was a lot of information to digest, and you were going through it very quickly. So going back to the caseload and visit frequency of 10 visits a week, are you planning to adjust that when people are on vacation or when they're out for
Yes.
Because people being out of the office will affect the number of visits they can do each week, and including, the training that you've that you've mentioned earlier that you want each region to do and things like that. So I just didn't know how you are adjusting to that in
there's
ECS.
language. Yeah, good point. There's language in the contract that does have say not weeks where there's paid time off, holidays, and those kind of things.
But how are you going to monitor that if there's not a current system in ECIS to account for that?
We can work with you, or we could figure that out. I'll put that as a question we can think about outside of just, hearing from you when staff are off, those kind of things.
Okay, and similar to that, currently in ECS, there's not a way to record when families are sick or they cancel due to, is that going to be modification in ECIS so that you can see, sometimes visits are canceled not through any fault of the home visitor, but the family is ill. And I just don't know how you account for that in the 10 visits a week as well.
Yeah, this is something we can add to our notes. Rachel, did you say you're taking notes today? Okay, thanks. We can take notes on that. I know in the past when we've had this 10 visit a week thing in our contracts, we've encouraged people to have a day where they reschedule that week. Obviously, if someone's sick for a week, you can't reschedule those kind of things. But do the best you can to reschedule families as if they cancel, maybe keep Friday open or blocked open or whatever day works for whatnot. We really don't want someone who's on a monthly schedule to cancel their monthly visit and then you really don't see them for 2 months kind of thing. Like try to reschedule people as soon as you can for those visits. But we will write this down and think about how we can, if there's anything we can do in ECIS, how we can document this kind of stuff.
Okay, thanks.
Laura has had her hand up for a while.
Hi, good morning. Thank you.
Morning.
Thank you. That was all really informative. I appreciate how it was all laid out. So that was very helpful. I just had a quick follow-up question. I know on previous conversations, we had talked about incorporating the rate card money into just the general contract, so it's not separate. And it seems like maybe this is showing that it is still going to be a separate pot of money. Is that something that you're still considering, or are you going to do it through the next, 2 years, finish out this contract term this way, and then evaluate it for the next one?
Yeah. So the conversation we approached last provider meeting was something we were thinking about doing for the next RFP cycle. And so we will be hosting, I don't know if we've heard in ACMs yet or if we haven't shared yet, but in June, I'll tell you now, we're going to be hosting regional meetings to hear how you think about moving that way regarding a scorecard, that's what it's called, versus a rate card where you have to earn the money. And so that if we just decide to go that way, that wouldn't be until the next RFP, so 2026.
Great, thank you.
Tish, I see your hand up, and then Tanika.
Yep.
Yes, good morning. We're all in the same office. Yes, they will. So the question we have is regarding 10 visits per week. Some of our clients are monthly, and also we work remote on Thursdays, which is our data entry day for us all day. So we average 8 visits a week because we're not here in the office on Thursdays. Also, it also depends on the consistency of the clients you providing services to, because on each one of our rosters, we have 1 or 2 people that's hard to contact. So it may not be a visit. So they may be biweekly, but you may only see them once a month because they're not responding to texts or emails.
Yeah.
That's one question.
So my response would be, no, that's okay. My response would be that it's like a formula that you have to create. You can have a minimum of 12, but you can have up to your maximum, whatever your model allows, could be 20 families. And so how you get to that 10 a week is really kind of a formula. Do you have like a sample of, families that are once a month, some are biweekly, some are weekly. And so it's really up to you to determine how to get to the 10 visits a week within your caseload.
That's a lot. Yes, and also some of our clients, for example, they all want 3:30 visits. So you can't fit everyone at 3:30 because they work at school. Either the parent going to school, the child is in school, and they get up from the bus stop with daycare. So that's a huge difference too. And we're off at 4:30. So you can't fit we book on Mondays, our 3:30 visits books up for the week very rapid. So like you said, it does depend on the case law and depend on the client. And also when you're in ECIs, it doesn't give you the option to say if the person is sick or the child is sick, you just have to type it in yourself. But it doesn't give an option. And Angelica has a question she would like to ask.
Okay.
So we're talking about the ECIS also. I don't know if we'll get to this further, but I have on my benchmark developmental referrals. For the ASQs. I put in there that they are receiving services, but it shows as if I haven't entered any information for that.
Okay, so that sounds like an ECIS issue that you're having.
Yeah,
So
yeah.
I would direct you to Ria, who can help you and triage your problem, and we can work on that off this meeting. Okay.
Ashley,
Mm-hmm.
quick question. I have some cases where they're usually regular, but because of cultural issues, they're from Pakistan. A newborn, they don't allow anyone in their home for 6 weeks for the mother to get back acclimated and the baby to get stronger. So, and I have another mother who's living at the Ronald McDonald House. So are we, and another mother who is right now in a home from Waterbury, but in a homeless shelter in Stanford because of availability. So these are some that what I have been doing is, and I don't know if you're going to find this acceptable in your 120 visits a quarter, is doing virtual visits, but then mailing the actual PAT papers that we have spoken about.
Yeah,
now,
virtual.
in cases like these,
I was going to say virtual visits are
these,
allowed based, as long as your model allows it, you can do virtual visits. So that's
okay,
fine.
because when someone's not available for you to go to the house, you want to keep them connected, and they're usually not available because of a higher need. Being hospitalized. For instance, I had a mom and Tish too, who were young and had strokes in rehab. And we keep these people because they need us more than they did before. But the only way to do it for me is a virtual visit and a mailing.
And
I don't want to be penalized with these 120 visits that at times, this irks me, sorry.
If virtual visits, if you do a virtual, sorry, Laura, I was going to say, if you do a virtual visit to Model Fidelity, it counts as a visit that week, counts as a full visit.
I just didn't want you to say, why are they doing virtual? Are they too lazy to get there? Well, there's many good reasons why we cannot. But what bothers me is there is no way to record this. I had a family once that went to Puerto Rico for 2 months, but stayed in the program. But when you see the data, nothing's telling you what's going on in the real world. It's just saying she didn't see him.
Virtual visits can be recorded in ECIS. It says virtual visiting to full model fidelity standards or whatever. So that would count as a full home visit.
That's good, because we work hard to keep our people, and we want to.
Yes, exactly.
Be able to.
Yes. I suggest you work closely with your supervisor to kind of figure out these families that have specific needs and those kind of things. And your ACM too, your liaisons. Thank you, stay well.
Thank you.
Karina.
Hi, thank you. I just have a couple quick questions. Some of them you might have answered. Is there going to be, to track these 10 visits, are you going to be using the ECIS? Like you're saying that right now we can track, we have 10 visits. Sorry, let me go back. Are there going to be new systems for tracking these 10 visits, or is it the existing things in ECIS right now?
Right now there's the existing things in ECIS, but we are developing a data dashboard that your liaisons can work with you on ACM's calls we'll have access to it. We're not, the field wouldn't have access to the dashboard, but they could work with you on your ACM calls to kind of dive down by home visitor if you want. But ECIS does have the ability to run a report by home visitor for a week or for a month, whatever you need to run it by. It's the summary report. Will tell you how many people they have on their caseload and how many visits were completed.
Okay, so it would be okay. And then you kind of led into a question I just wanted to highlight from the chat that Maureen asked, that I had a similar question about if the 10 visits per month per week, if that's going to be looked at weekly, or is it a monthly average? Is it a quarterly average? I don't know if you have that information.
I don't have it specifically right now. I think it depends on how we're going to do that moving forward. Like, how is our contract evaluation going to be changing or modifying? 10 visits a week. If there's 4 months in a quarter, it'd be, 4 weeks in a month, sorry, there'd be 40 visits that month, those kind of things. So it all kind of depends. I don't think we're gonna be looking each week, but we haven't figured that out.
Is that all going to be spelled out before July 1, so we understand the expectations and how the data is going to be looked at?
Yes, we could figure that out.
Okay.
Probably be in the home visiting manual.
Okay, and then my other question, I guess I don't know how to ask it, but I guess these 10 visits supersede our own model fidelity. So for our own models, we might have different number expectations, but you guys are saying as the funders, this is what's expected, 10 visits regardless of the model.
Yes, and we checked with models and we're not going above what they've asked. So it's either their maximum or their minimum that we are following to.
Okay.
I saw some more hands up. Okay, Carmen.
Hi, Ashley.
Hi,
I
Carmen.
just wanted to ask if, like, we have families too that sometimes leave for 2 months or 3.
Mm-hmm.
Should we close them and then reopen when they come back?
Because
that's
yeah, definitely 3 months, yes, because we have I forget what the policy is
right.
called in the home visiting manual. There's what's the creative
Or even
outreach
2
policy.
months. Yeah. Well,
Yeah.
they've told us that they're going to be away for 2 months at least, or even 1 month.
Yeah.
1 month, we worked that out, but
Mhm.
2 months, I mean, do we
I mean,
just
2 months, it depends on what, I think the creative outreach policy is after 4 weeks of no contact to close them. You could be missing dates of benchmarks that are due, those kind of things. And if you're
Right.
not really meeting with them, it does make sense to close them and, reopen them when they come back to you.
Okay. All right. Yeah, that makes sense. Okay. Thank you, Ashley.
Yeah. Tanika?
Thank you. I have a question in regards to the rate card payment. So as we know, and I'm hearing that there's still issues with the ECIS with populating information. So when we're sending you these invoices, normally we send you an addendum to the invoices. So once you receive the addendum, will you guys still be sending back a corrective invoice to us to let us know the correct amount that will be I guess, calculated for that reporting mark period?
So I'm not, maybe Connie, you're on the call, if you knew of anything with rate card being an issue with reporting. Connie's joining.
Yeah. There isn't, Tanika, and if it's okay, Rhea, I might put you on the spot. There might be some isolated issues, but my understanding is that everything, at least as far as payments goes, that numerator value, my understanding was that was all working unless there are things that have come up in the last few weeks that I don't know about. I will tell you the denominator for measure 4. I know that there are still some outstanding issues there, but that has nothing to do with payments, right? It's just those numerator values. So Rhea, at the risk of putting you on the spot, maybe you could speak to if there is anything. Like I said, if there is, I think it would have only come up very recently.
Do not see any issues with rate card. I just received like one issue. But if you have any issues, please do send me the ID and I can look at it. What's going on?
Okay, thank you. And also my next question is in regards to the pilot. In our previous meeting, there was some discussion whether or not OEC will be sending out consents to give to our staff for the employment module. Asking that because when I discussed it with the staff about the new module that's being implemented, there was questions on would OEC be sending the consent because they would like to be able to give their consent to share this information in the ECIS module because it's not really based on the information that you're asking for is not really based on the outcomes of the families. It's more or less gathering the data of the work, the staff, the direct staff. And they also wanted to know who will be seeing this information outside of, well, who is getting this information basically.
Yeah, we can work with, we can respond to that outside this call just so I don't confuse any other people that are not part of the pilot. But home visitors can enter their own information is what we landed on, I think, Connie, correct? And so they don't necessarily need to release their information to you if they want to fill it in themselves, except salary. I think we might require someone else to enter that knows salary information. But I'll respond to you outside, Tanika, if it's helpful that way. Sorry.
All right.
Any other questions from you?
Oh.
Okay. Leora.
Yeah, so I'm still digesting the information. So I appreciate that you will be sending out the slides so we can look more closely. But there's clearly more strict guidelines around payments or around submitting invoices and when things can be paid. I know a part of the problem, and I'm sure OEC is aware of this as well, is that we haven't received the payments on time, right? They've been delayed, and then we have to spend them quickly and get all the invoicing back to you. So am I assuming, like in this next contract, that will be improved as well, that the payments to the sites will be made on time so that we can adhere to your reporting requirements as well?
Yeah. Are you talking about base services or rate card payments or both?
Maybe both, but I was thinking rate card. There's been some delays with rate card. Yeah.
So rate card, that's why we're making these changes where we're going to pay them in the first 2 quarters, your entire amount, whether you earned it yet or not. Because yes, right now we have to wait until you finish earning them June 30th when the contract ended June 30th or the budget year ended June 30th. So we can't make a payment to see what you earned currently until June 30th. And so that's why we're moving it to the first 2 quarters. So you'll get your if you think of a budget year, you'll get your entire rate card payment in by the time January comes. You'll get half of it in, July or whatever. Or half, no, you'll get your entire rate card payment by October, I would assume, because we make quarterly payments at the beginning of the quarter. So that way you'll have time to earn it or not earn it, spend it down before you have to report on it in June.
So you're sending us the whole amount as opposed to what we typically earned.
Yes, and then your fiscal people, whatever you didn't earn or whatever you didn't end up spending. So it's more like monitoring on your part too.
Okay. Yeah. I see what you're saying.
But we'll work with you. We'll work with you each month on your ACM and say, we noticed this quarter you've earned, $5,000 of the $10,000 we've already given you. So feel free to spend 5,000 and, try to keep.
So we have, I imagine we have to make sure we're seeing the same amounts in ECIS. Right.
Yeah.
Okay.
Which should be working, like Connie said, unless there's new things that you guys have discovered in the past couple weeks, let us know, but rate card is working.
Okay.
And then Paloma. Or no, Mia, sorry, I skipped over Mia and then Paloma, sorry. Mia, if you're talking, you're on mute.
Hi, it's me. I'm here.
Okay.
I was closing my door because my dog was barking like crazy. From home today. I do have a question, which is I don't know if this is the right platform to actually ask this question. This is about this current fiscal year and the COLA increase. We just received an email yesterday that it just came out. And so I was asking on a meeting that I had yesterday with Lindsay and Lab. We had to do some budget adjustments recently that require that we actually move some funding from other categories other than salaries and benefits to increase or to bring the salary to the new OEC standard. So when that email came out, she was very specific, and she said we can only use that COLA increase for salary and benefits. But what happened to the changes that we did in other line items that we were forced to do because we didn't have funding to actually bring the salary to the new OEC, expected salary for home visitors?
I would suggest you do another revision and add the funding back to those, since now you have these funds for COLA or salary and fringe, if that makes sense. Or if depends on the line items you moved it for, we have those ARPA funds. So if you needed equipment or, training, feel free to apply for the ARPA funds, or rate card funds is another option.
Yeah, we kind of had to touch some of those clients' line items to actually be able to accommodate the salaries, which, it kind of does affect the how we perform and what we can do for our families. So I just wanted to put it out there and just to make sure that it was okay to actually revert those changes that we did previously.
Yeah, absolutely.
Okay. Thank you.
Yep. Paloma.
Yes, good morning. I don't know if this is really a question or it's more a wish, but I'm going ahead and ask you. So I don't know if OEC is planning to standardize home visits with best practices across the state. I know there are different organizations who are running this model or this home visit program, but I hear from the PowerPoint you share, coming July 1st, we are going to be moving to 10 visits a week for the home visitors. But I don't know if you have in the future, I don't think this is something that should happen. It needs some planning, it needs some time. So I don't know if the OEC is thinking about having a little more of best practices like other programs across the nation, like the first visit should be in person, because for engagement, after that, it should be every other week. And according to how the families are completing their goals or their needs, then you move it to every 3 weeks or whatever is happening, and maybe have those results. Of course, this is over time. The change doesn't happen from tomorrow, but I don't know if this is something that in the future OEC to have everything as planned, as suggested by you guys, 10 visits a week by the home visitors. So maybe to meet the goals or the outcomes, it will be an easy way and give us some cushions to have our staff move little by little and then complete those numbers that are requested. I don't know if this is a question or it's a wish, and I don't know if you already talking internally with OEC.
I think that's good feedback. I think we would, if you could, to say, are you in Region 4? Are you at the village?
Yes.
Okay. Yeah, if we could have those, give Steph a little more information and so you can share with us. But that is interesting and something to consider. So I don't think there was a question. I think it was more of a comment, and I'd love to explore that with the OEC here.
So Ashley, are you gonna thank you for that. There's questions in the chat. Are you addressing them here, or are we going to take these questions back and respond later? There's something that Karina had in there. Can you see it?
Going through them.
Oh, that is the last statement. Was there I see some things people are responding to as it. I just wanted to draw your attention to questions.
Was there a moment when the OEC had said this would be the last contract year? It was always going to be a 5-year cycle. We just have different contracts, timing and executing because of different, it was either easier to amend them or either easier to give new contracts. So it was always going to be a 5-year contract cycle. But it probably could have been confusing. Sorry, I hear feedback. It probably could have been confusing because we've had a 2-year contract, now a 1-year contract, and now a 2-year contract, instead of just the easy way we all would have loved a 5-year contract.
And then Jill has a statement. Are you still seeing the chat?
Yeah. Jill, this is great thing to bring to those June meetings that will be on the differences between rate card and scorecard and what you think would be a good way to move forward in the next contracts. This was a way so that we can't make everyone happy, I feel like, and we can't have the perfect situation. It's either you get payments late and you have to spend them in a month, or you can get them ahead of time and track and monitor your spending with your budget liaison. So please, let's see how it goes for these 2 years. And then in June, we'll have conversations and dive deeper into the differences between rate card and scorecard and what would be easier and best for our system. And if there was other questions, I think there's a lot in here. I don't know if I want to sit here and read them all, and with your valuable time and 8 minutes left. So if there are questions in the chat that we did not get to, we will be answering them through a FAQ, if that makes sense. We can send that out with the recording of this and these slides.
Right. And then so no, I think Stephanie put a couple things that points of clarity with regards to these upcoming meeting dates will be discussed in our April ACM calls. And so just as a reminder, ensure that you check in with your program liaison to see if you want leadership to attend the ACMs that are coming up in the future. And then these are also the opportunity for you to kind of go through with your program liaison individually what you feel as though would be a cadence that would be appropriate for, or an expectation for home visits. I mean, we share what's going to be in contract, but the ACM will give us an opportunity to individually talk about what the stage situation is as individual providers, so that we can have a little bit more context when we are reviewing those said visits on a monthly, bi-monthly, or quarterly basis. So give us the context while we're in these ACM calls in April to be able to give back to leadership.
Lisa, that's a scorecard. Talk about it in June. And so I want to open up to if anyone has announcements or highlights or, something exciting to share at their site. We're approaching spring, so I don't know if any events that other regions could attend or families can attend.
I could mention, Ashley, we're having our teen, we're calling it teen mini conference on April 19th. And I've put it out to, Region 6, but if there's anybody that, any teens, teen parents that wanna, I could send out the flyer. I think I send it out to Jennifer, and she could put it out in case there's anyone around, in the area or whenever, where, anybody from different towns could come. But it's focused on for the teens, teen parents. So that's a big event that we're having here in New Britain on April 19th.
That's awesome. Thank you, Carmen. I'll share it with Sadia, and then Sadia can send it out to everyone with the weekly update.
Yes.
That sounds great.
Yes.
All right. Anyone else? Any staff retirements? Sue?
Sorry, it took me a second to unmute myself. Families Network in Danbury is hosting our annual Volunteer Appreciation Luncheon on May 1st this year because of just some technicalities, and all are welcome. There's individual tickets are free, and it is a great opportunity for us to celebrate our community partnerships on child abuse prevention. And this year we have a guest speaker concerning building resiliency and trauma, addressing trauma issues, and tying that into ACEs and the parallel process of the vicarious trauma with our staff and the work that they do with the families. So we're really excited about the lineup this year and invite you all to attend.
That sounds
I can
great,
share
Sue.
that.
Yeah. Can you share that with your liaison, and we'll put it out in the next email?
Absolutely. Yep.
Thank you.
Thank you.
All right. Anyone else before we wrap up? Okay, well, if not, we will be sending this information out with the recording, and I hope you all have a great spring if I don't talk to you before the next provider meeting. Bye, everyone.
All right, thank you.